Alo, alo, alo. Ini semua memang ada cek ini semua ada. So this social asset account.
So we independently mark, right? So I give marks, she gives mark for that one. I forgot to ask that question.
I think, yeah.
Right. I think last time we
To mark it.
You sure got it?
Yeah, I got it.
To mark.
Right, reflex semua boleh nampak.
So the mark that I stand there is the total mark.
I think last time we
I'll just keep the copy and pass them.
Because 7 students.
Yeah, actually you will have 6. Either 5 or 6.
So sorry, SR5 now, that's what you use that. The competing one is it? SR5. They call it now in SR5.
Yeah, ready.
okay, we have
At corner, I feel so kesannya pula. Can we move? Check this.
Yeah, can.
So they already have to set up.
That's not from this side, I think you see from this side.
I think see everywhere also can.
I worry.
This one they need to show the other teammates how are the.
Oh, they're doing things. Kalau we sit there, you sit there. Boleh? Tapi sana okey. Can ah.
Maybe you all will sit here.
Tak boleh kacau, tak tengok tak.
We don't say, oh, we wanted to rearrange the input, so it starts off with them reading the question.
Yeah, tengah-tengah, betul?
Then,
Easier.
yeah. So the chair moves there.
Middle.
Bagi.
Masuk.
Okay, smile. Nice.
Okay, sebelum kan? Macam-macam je.
Kalau dia dah lama tak guna ni, dia fikir kat masa nak guna, kau nak tengok.
Nanti yang ganti pula ni.
I ask him like good.
No, it's okay lah, if I already started everything. Because it's 1 hour.
Mungkin tengah-tengah.
Kalau it's just nearby here.
Yeah.
I'll just run quickly if they haven't finished the video. Are they starting now?
What?
Dah.
Aduh saja.
Apa is senior, is it? Is that okay?
I think I can just say yes, okay. Whichever.
Or if you want to see their technique, maybe you can see that. I don't know.
They would demonstration.
But I will be there, nanti they will feel someone is
Yeah.
really over the neck.
Coaching. Okay.
If they brief together, one group will never, or at least bringing for briefing 4 at a time. If not, then the later group mentally prepare what to expect. Or the first one that goes, what year are you in? Fifth, yes.
Nanti kita bisa.
Saya berjaya tak?
Ya.
Berdaya dekat dengan sekolah puteri yang
No, less cold than the other bed. It's super cold.
Do you prefer very cold or like that?
But this is good. Maybe not good for the candidate.
We can lower the increase the temperature over that side if you want.
That one,
It's too
that
cold.
you don't need to go in there anymore.
Yeah,
Just
that's good.
now, that's like
Yeah, correct.
shivers.
Where are you from? Which?
Orion.
Yeah. The team also competing today.
What?
Gelap.
I just say enjoy je lah.
Ya, betul.
Yeah.
Both of you from USDN.
no, I'm from Taylor's.
From where?
Taylor's University.
Taylor's.
You've been here long? You're
Yeah.
a student here?
No, I am the staff here, simulation technician for 15 years already. Yeah. So I need to do all those live broadcasting, simulation, later we have simulation.
Is it a big team, the simulation team? I know Prof. Tito is big on simulation.
Yeah. It's, with the nurses, I think around 11 people, including me. So we got 3 technicians and we got 8 nurses. Yeah. So we handle this simulation center. This is all simulation center.
Very nice.
We have high fidelity, so later you will see the high fidelity in over that side. We have 2. And we have 3 actually, we have 3. And one more in Delhi, we have total 4 high simulation.
The
High
total
fidelity.
immersion room where is the green wall is here
Green wall
or
is in Kijali. We have one here. One very costly.
Orang punya clinical skills immersion.
And we also have VR. We got 5 set of VR for the student. So I'm the creator. I'm the content creator.
Content creator.
For the VR.
Influence.
Use VR to see how to. So that is
No, not
contohnya
here.
CCR kan. So
VR
orang
in
will
other
be,
thing.
dia
Just tell
ada
them.
dia buat macam immersive lah. So your immersive.
I am.
Yeah. That's why I'm here.
Because you have smaller number of patients. Tapi not small at all. Satu batch 400 something right?
Satu batch dah
400 kan? Because for private.
Satu batch 400. One cohort lah.
One intake 400 And two intakes lah.
2 intakes. 2 intakes. 1 year 2 intakes.
So 400 and 400.
Right. More than, I think more than 1,000. Not included the pharmacies, dentists, not included. Only medicine. Medicine, yeah. Around that. Like our SEM 6 also we have 120. 120 for SEM 6, SEM 7, SEM 8, SEM 9. Added up, one cohort is around 400 to 500 students for medicine.
So many making with Hey.
That's why you need to do a lot of storage.
Yeah, simulation helps lah.
Yep.
It does. UADM has got 200 per batch per year.
Yeah. Because we got 2 open days, that's why we have 2 batch.
Why 2 batch? 1 year sekali intake enough lah.
1 year 2 intake.
Yeah. Too much.
2 days. Bulan 6 dengan bulan 12 macam tu.
So bulan 12 intake, who's going for holiday? No one. Nobody.
No, this is example only. Maybe bulan 1. That's why we take 6 months lah. Let's say bulan 1 and the bulan 7 open day. Open day is on June. On July this year. No, this month, sorry. This month is the open day, 21st July. So another open day is around January or February, not sure when.
Past the winter time.
Yeah, two open days.
Open days. Student intake not confirm 100 students, sometimes less, sometimes a lot. Because of the economy and also how is the
So
fees.
the number varies lah. But significantly, batch by batch.
Yeah.
Is it?
Sometimes less, sometimes a lot, sometimes very less, 50 over 60 students on batch.
So does it get really small after the training? The training number
Yeah,
is
after the training, I think nearly half of them.
You're not going?
No, I'm
Only here.
local.
Not here.
But does that mean you get another degree in that way? It's a Bachelor of Science.
There's another program where you can take another degree in 3rd year. That's what we call like graduation program. We have biomedical science.
So those who go for the training program, are they given another degree?
Sorry, doctors, you're from which
Venus?
Davis and
UITM.
UITM. This one, the other thing is, though the lights will be on kan, kalau dia pasang, but they don't switch on the light because you can see whether they switch on the light or not. I think I put this standardized for all.
What if the student asked me to go and turn off the light? I just turn
I told them already the lights will be
Oh,
turned off.
okay.
I told them the lights won't be turned off. They know it's an ophthalmoscopy station because Dr. Tiru already told them. So I told them initially, I didn't know that she told them, so I said, this one, normally we turn off lights, but now we're not going to turn off lights. Then after that, I knew they were ophthalmoscopy stations. So they must switch on the light lah. Kalau they tak switch on the light, then we have to mark them down lah. Okay, so this is stainless and UITM. So we won't send more students to
First assemble, then turn on, then check focus, and then look. No, emergency.
But she do them all.
But we still
She
do
do them
this.
all. I have to slap. OMG. So bad.
The my specialty is general.
No, especially someone general.
Generalist.
Special.
Your students are going to come in.
Alright,
You have a 2 minutes reading time. Tell you once for 2 minutes.
Oh, okay.
Morning, Mr. Ahmed. Today, I would like to do a procedure in your eye. Can I get your permission? And also the sharp one. So I will just invite. I'd like to check the eye for the retinal vessels. I see an apple retinal vessels to the optic disc and to the optic top. And then I would like to ask Mr. Ahmad to look first to look at the front, and then after I find the optical and optic disc, to look at the red light to check for red reflex. Yeah, and I like to check the abnormalities in the macula and also the optic disc. So the first photograph, this photograph, it seems that there is like distortion in the optic disc area, but it's quite normal. And in the photograph 2, there is ring at the optic disc, and also at the fovea at the macular area is abnormal due to the there's like multiple lights in it, and also there is like peripheral you can see like darkness, and also at the third photograph, I think in the second photograph, it could be like small microaneurysm. So in the third photograph, there is like retinal hemorrhage. So increase the cup-disc ratio. And I would like also to finish the information with checking the intraocular pressure. Oh, let's take the analysis. So I think the first one is glaucoma. I think, and the second one is diabetic retinopathy. Proliferative diabetic retinopathy, because I can see that microaneurysm and also neovascularization. And the third photograph is the third one is also diabetic retinopathy, because there is also retinal hemorrhage. I think the first one it's glaucoma, and also there is an increased cup-disc ratio. Yes. I think that's it. Okay. I think
There's a share also. You don't need to turn that up.
Um, so, hi, good morning, Mr. Ahmad. I understand that you have reported some blurring of your vision of the past few months and some distortion in your images. So what we are doing today is that I will use a device called an ophthalmoscope to examine your eye. Is that okay with you? So for this process, I will need to place some medications called Timolo to make your pupils open slightly bigger for me to look into it. And I hope you have someone to drive you back later. That would be great because sometimes some patients will be very busy and their vision will be a bit blurry after the medication given. So do you agree to proceed? I say yes. Okay. So I will administer the Timolo. Okay. Then assume I will wait for a few minutes before I proceed. So now the pupil is fully dilated. I will check if my device is working. Okay. Okay, so now I will switch off the light. I will examine the right eye first. So Mr. Ahmad, I will please look at front. Just fix your eye on one spot. I will examine your right eye first. I will go towards near you. So please don't be intimidated. Okay. So I'm examining the right eye with my right eye on my right hand, looking for the any presence of the red reflex, which I assume there will be in this case. And I will go nearer. And try to visualize the optic disc. Try to visualize if there's the borders of the optic disc, the color of the optic disc, and the cut to disc ratio. After that, I will try to visualize the macula. Try to trace the blood vessels to see if there's any AV nipping, any abnormalities regarding the trails of the blood vessel, any neovascularization. Regarding the macular, is there any exudates or any discoloration, any pallor? Moving on, also check the central part of the fovea to see if there's any red spots or like widened fovea. Okay, so I'm done with the left eye. Done with the right eye. Now repeating the same thing on the left eye. Examining the left eye with my left eye, with my left arm. Again, at a degree of 15 degrees, check the red reflex as it's present. And now I'll be going near. Again, visualize the optic disc. Visualize the optic disc. Check the color, check the border, and check the optic cut to disc ratio. Now trace the vessels. Trace the vessels. See if there's any AV nipping, any copper lining along the spots, along the arteries, And in your vascularization, next visualize the macula. Is there any exudates or any discoloration? Yep. Okay. So Mr. Ahmad, I'm done with the examination. I will switch on the lights. It's like three different or from three different. Um, This one I see for photo 2. Sorry, maybe I start with photo 1, photo 3 first. I think this is a central artery, central retinal artery occlusion because I see like this central red fovea, classic cherry red spots. This one I think is age related macular degeneration. And this one probably there's some exudates. So hypertensive retinopathy.
Can you just read the question too?
Very improvised. Difficult to read everybody's faces. Review the 3 fundus photographs and describe the findings. Okay, so these 3 are all ophthalmoscopes of the fundus of the right eye. And for photo 1, there's general pallor of the macula with darkening of the fovea. And there's heavy lipping here, so this will be photo 1 will be hypertensive retinopathy. For photo 2, there's some exudate seen, and some darkening of the peripheral macula. Diabetic retinopathy. Yeah. One probably. Yeah. That's it.
2 weeks after 2 weeks after the
I can like stand and examine.
Yeah.
I can see this picture or not here. So first I'll be looking for red glow. So I'll ask the patient to look like straight and then look for red glow and then okay, so then I will ask the patient to look forward again and then I look straight into the eyes. I will ideally like to off the light for this examination and then I will proceed. So when I'm looking first, I look at the optic disc. Optic disc size, shape, and also if it's pale or not. And then I would also look at the peripheral retina for any exudates or hemorrhage and anti-macula for any exudates or any degeneration if it's pale or not. And then looking for any vascular changes also. And then after that, I ask the patient to look straight into the light to check for foveal reflex. And after I finish one eye, I do the same for the other eye as well. And look for the same. Do I need to repeat the same thing that I just said? Okay. So again, I ask him to look like straight, and then I'll again check for the optic disc and the vessels, if to see any vascular changes, and also for exudates and hemorrhage, and then look at the peripheral retina as well. After that, I'll ask the patient to look into the light to look for foveal reflex, and that is all for fundoscopic examination. In photo 1, I think it is hypertensive retinopathy um, with few vascular signs like not sure exactly what it is called. In the next one, there is soft exudates over the macular region, and the vessels are a little bit tortuous. So I still think this could be again hypertensive retinopathy, but like either stage 3. And in the last photo, there is blotting hemorrhage present over the macular region, and no hard exudates over the retina. And I feel like also the optic disc, the cup to disc ratio, no, sorry.
This one for the
I think it's diabetic retinopathy, non-proliferative diabetic retinopathy.
7 months, 20 days.
So a very good morning, my name is Jasmine, a future medical student. So today I'm going to examine your eye and I'll have my chaperone with me, so is it okay? Alright, so I'll move on to inspecting the patient's eye. Okay. Firstly, I would inspect the eyelids. There's no swelling, no redness, there's no extropion, extropion. And then the eyelashes are fan outwards. There's no abnormal growth of eyelashes. And then moving to observing the eye, there is no exotropia. There's no redness, there's no discharge, there's no tearing. And the pupils are equal in size and it's circular. Okay, so now moving on to use the only Okay, I'll just move on to describe what I'll do with the fundoscope. Okay, so I will be 30 cm away from the patient, and then I'll go to the patient's, in order to examine the patient right eye, I'll be on the patient's right side, and then I'll look into the patient's eyes, the fundus, at 15 degrees, and then first I will want to like trace the vessel. So I will be able to see 4 main vessels. On the nasal side, I will be able to see the superior and inferior, and on the lateral side, I will be able to see the superior and inferior temporal artery. And then after that, I will want to see the optic disc, if there is any swelling, and then the cup ratio of the optic disc, if there is any edema. Then after that, I will move towards the macula, to take a look at the macula, and then overall to see if there is any hemorrhage, if there is any hemorrhage, exudates, and tortuous veins, and gut blood, and cotton wool spots. Yeah. And then after that, I will will thank the patient at that time. I managed to open the ophthalmoscope. Can I do it again? Okay. Okay. So, as I mentioned, I would like to see the fundus and also the vessels from the optic disc, and then also to the macula, trace the macula and see if there is any abnormalities such as like exudates and any torsions, vessels, any hemorrhage, dot blot, cotton wool sign. Yeah. That's it. And then now I would like to interpret the findings. So on the first photo, I can see there is swelling of the optic disc. Swelling of the optic disc. And second picture, I can see cotton wool spots, exudates. And the third one also I can see, and the second one also I can see like there is a reduced cup to disc ratio. There is edema. And for the third picture, I can see there is also hemorrhage and there is pallor on the fundus. And also the cup to disc ratio is reduced. There is also tortuous vessel on the second photo. Thank you so much. Thank you. Thank you.
first I'll greet the patient and explain that today I want to perform a ophthalmoscope that will involve me using an instrument to view the internal layer of the eye, and I will shine the light on the patient's face and take his consent. After patient agree, and I will start off with the external examination first. First look at the symmetry of the eye, if the eye is symmetry, and the eyelid, is it swollen or is there any redness on the eyelid? And next I'll look at the conjunctiva, if the conjunctiva has any injection, any redness, and take a closer look at the cornea. Is there any corneal haziness, any connection at the behind the cornea? And next I'll look at the iris. Is the iris completely round? And what's the color of the iris? Any foreign material on the iris? And lastly, the pupil. If the pupil is round, and is it dilated or is it constricted? Before the ophthalmoscope, I will drop an eye dilating medication for the patient and turn on the light and start doing my ophthalmoscope. Yes. Check this. Sure, see. Oh yeah, there's dim light, but it disappears. Okay, sorry. So I'll adjust the focus first. After the focus, and the red reflex first. Both eyes. The red reflex is present. Then I'll go to the look for the vessel first. Find the vessel, then I'll trace the optic disc. In the vessel, I'll look for is there any glucose vessel, is there any silver wiring, any vessel constriction, and on optic disc, I'll look for any, what's the cup-disc ratio, is the optic disc, color of the optic disc, color of the optic disc, is there any, and the shape of the optic disc, the margin, and is the optic disc swollen, then is there any sign of glaucoma in the on optic disc? Am I supposed to see finding in this model? Then after looking at the optic disc, I'll look at the macula. Macula will look for any macular edema and any macular star sign in the hypertensive retinopathy. Then I'll look at all the other 4 quadrants. That's clear. Is there any hemorrhage on all the 4 quadrants and any deposits such as cotton wool spot and other hemorrhages? And then I will proceed to examine the opposite eye. Then after the ophthalmoscope, I will thank the patient and finish my examination. For photo 1, this is normal ophthalmoscope finding. There's no hemorrhages, no deposits, and the vessels are clear. There's no neovascularization, and the cup disc ratio is less than 0.3. For the second photo, I can see there is drusen's located over the macular region. Otherwise, there is no retinal hemorrhages, and the vessel appears to be more tortuous, and the cup disc ratio is still normal, smaller than 0.3. For the photo 3, there is a subretinal hemorrhage located around near the macular region, and with the background of drusen still being seen, the vessels appear to be normal with appropriate size and appropriate shape, and the cup disc ratio is still less than 0.3. So there's no glaucoma changes on the retina. So based on this finding, the provisional diagnosis for this patient is wet age-related macular degeneration of both eyes.
Which one? Photo 1, photo 2.
So this photo 2 is dry ARME. Photo 3 is wet ARME.
I happen to be near him macam bila UM. UM ya? I think he's very a lot. Yeah. Confident.
I only check one eye.
Why
The side he just went in.
I turn a blind eye because everyone else is so bad. Kejap, I tak kira. Nak dapat fumak sah? Dia bagi fumak?
For the makan one eye.
Lupa lah.
Yang the diagnosis, yes, it's correct. It's correct. He's the first one to get
Yeah, very good. So fumak sah?
Yeah. Bottom fumak, just the technique, wrong hand. The first one. Wrong hand.
You too particular. I settle for less.
Your question is that instrumental.
I settle for less. Second rated also good enough. Oh no, this first class lah. Kalau nak makan kat sini.
Kejap lagi lunch. Simple terus.
Oh lah, I macam lah ni. Then lunch dah buka apa?
After this is a break, right? Another round.
Ya. Nanti our timing dah lari sikit dah.
Lunch supposed to be 1:30 to 2:30.
Oh. Timing okay what? Another one after this?
I think the
Why not?
timing delayed already. Because UKM.
Hah? Dah kan UTM je? Oh, maybe dia punya baju similar to the uniform. They all wearing dark blue, eh? Purposely, is it?
They wore formal. All of them were formal.
But kebetulan today many people are blue. I don't see red, pink.
Red Jonah, cannot.
Itulah.
Russian will be
PPH. PPH for us. I selalu je pakai merah yang like punya PPH.
Tapi pakai tie muka tak?
Suka hati radio. I don't believe in this drama. Like
Saya
I
pernah dapat award PP paling Jonah.
why would I wear red?
No, I don't wear red, but when I'm on call, it will be very bad stuff.
Finish?
Yeah.
Okay.
Yeah, because 11, so I sent to them. So you all can do that.
Okay.